Vital events are marriage, birth. Details. Vital events: live births, deaths, fetal deaths, marriage, divorce, adoption, legitimation, recognition, annulments, legal separation. Reproductive health care is provided in the community by home visit by FWA, community clinic, Upojela Health Complex, Union Sub Center. An emergency contraceptive method is a temporary method, ideal method for preventing unwanted pregnancy, available in the market. Abstinence may cause repression of a natural force, nervous breakdown, temperamental change. Breastfeeding is contraindicated when mother suffers from HIV, active tuberculosis, septicemia. Breastfeeding is contraindicated when mother suffers from HIV, active tuberculosis, septicemia. Determinants of high fertility rate. Determinants of high fertility rate: early marriage, poor living condition, low literacy rate. Ideal candidate for intrauterine contraceptive device should have regular menstrual cycle, access to follow-up, willingness to check the tail of IUCD. The ideal IUCD candidates who has born at least one child, has no history of pelvic diseases, has normal menstrual periods, is willing to check the IUD tail, has access to follow-up and treatment of potential problems, is in a monogamous relationship. Pillars of safe motherhood are family planning, antenatal care, essential obstetric care. Details. 6 pillars of safe motherhood: family planning, antenatal care, obstetric care, postnatal care, post-abortion care, STD or HIV control. Demographic process includes mortality, migration, social mobility. Details. Demographic process include fertility, mortality, marriage, migration, social mobility. Modes of action of IUCD are: acts as a foreign body, alter cervical mucus, affect sperm motility. Details. IUCD ওভুলেশনে কাজ করতে পারে না, এছাড়া সব ধরনের কাজ করতে পারবে। Absolute contraindications of OCP include congenital hyperlipidemia, thromboembolism, cardiac abnormality. Details. Absolute contraindication of OCP: cancer of the breast and genitals, liver disease, previous or present history of thromboembolism, cardiac abnormality, Kong hyperlipidemia, undiagnosed abnormal uterine bleeding. Breastfeeding is contraindicated when mother is HIV positive, mother receiving chemotherapeutic agents. Details. Contraindication of breastfeeding. মায়েদের ক্ষেত্রে in mother, serious psychiatric problems, inverted nipple, fissure, cracks, acute fever, TB, kidney disease, breast abscess, septicemia, breast tumor. আর চিলড্রেনের ক্ষেত্রে গ্যালাক্টোসেমিয়া, অ্যাবসোলিউট কন্ট্রাইন্ডিকেশন, এছাড়া আছে ফিনাইল কিটোনিউরিয়া, গ্রস প্রিম্যাচিউরিটি। Male sterility is related to orchitis, undescended testes. Details. 4 main causes of infertility in males. 1 unknown cause, 2 gonad disorder, orchitis, undescended testes, 3 sperm transport disorder, 4 hypothalamic or pituitary disorder. Vital statistics include birth, marriage, death. Vital statistics include birth, marriage, death. An ideal contraceptive should not be, এখানে ট্রু অ্যান্সারগুলো ফলস হবে, irreversible, costly for target couple. Demographic process comprises. The demographic process comprises mortality, marriage, fertility. Details. Demographic process, there are 5 processes: fertility, mortality, marriage, migration, social mobility. Demographic process includes fertility, mortality, migration. Population policy formation requires size of the population, fertility rate, density of population. Demography includes fertility, migration, mortality. Vital statistics include birth, marriage, death. Social mobility includes rural to urban movement, change in income state, change in social status. Vital statistics include all except answer migration. The false answers are birth, death, morbidity, marriage. Vital statistics include all except migration. The false answers are birth, death, morbidity, marriage. Vital statistics deals with natality, births, morbidity, sickness, mortality, death, fertility, marriage, divorce. Benefits of exclusive breastfeeding are: child grows well, child suffers less infectious disease. Demographic processes are fertility, mortality, migration, social change. Postcoital contraception includes intrauterine contraceptive device, hormonal methods, post-conceptional methods, progesterone only pill. Vital statistics includes all except migration. False answers are birth, death, morbidity, marriage. Sources of primary demographic data are population census, record of vital statistics, report of demographic and social survey, published demographic yearbooks. Absolute contraindications of oral contraceptive are liver diseases, cardiac abnormality, abnormal uterine bleeding. Demographic process includes social mobility, fertility, marriage. Superiority of breast milk. Superiority of breast milk over cow's milk are: breast milk is free of contamination, contains more iron, easily digestible, nutrition value is more in breast milk. The main indications for artificial feeding are mothers suffering from fever and diarrhea, prolonged illness of the mother and failure of breast milk, phenylketonuria of the baby. Phenylketonuria of the baby. The following are the sensitive indicators of family planning achievement: general fertility rate, total fertility rate, abortion rate. The false answers are growth rate and birth rate. Details: fertility related statistics, birth rate, general fertility rate, general marital fertility rate, age specific fertility rate, age specific marital fertility rate, total fertility rate, total marital fertility rate, gross production rate, net production rate, child woman ratio, pregnancy rate, abortion rate, abortion ratio, marriage rate. 5. Demographic process: fertility, mortality, marriage, migration, social mobility. Demography in BD in 2015 or 2016. Cut.